Hi, I'm Dr Angela Sharma and I'm one of the trustees and on the medical advisory board of the Menstrual Health Project. Today I'm going to talk to you about premature ovarian insufficiency. So premature ovarian insufficiency is the term that's used when women go into menopause below the age of 40, and this will happen to about 1 in 100 women. In 90% of the cases, no actual cause is found, and this can be quite devastating to women. But in 10%, there may be a reason behind it, such as chromosomal abnormalities, autoimmune conditions, enzyme deficiencies, sometimes infections. And then there's also all those women who have had damage to their ovaries in some way, either because of cancer or the treatments of cancer or surgery to remove the ovaries. And if this happens below the age of 40, then they all get put under the group of premature ovarian insufficiency. It can be really hard to diagnose it in yourself, especially if you're on a contraceptive pill. But for those women below the age of 40 who are not on a contraceptive pill, and if you start to have either very few periods or periods that are very spaced out or no periods at all, or if you may or may not have menopause symptoms with it as well, then please go and see your doctor to go and talk to them about it. Usually most women don't really know that they're going through early menopause, and it's picked up during fertility investigations. The way you diagnose this is different to normal menopause in that it's not based on symptoms, but it's actually based on a blood test. And so you need 2 blood tests 6 weeks apart of your FSH levels. And if they're above 30, then this is how we diagnose premature ovarian insufficiency. It's really important not to miss the diagnosis. And we continually hear women who get told by their GP that it can't be menopause and they're too young. So it's a diagnosis always to have at the back of your mind whenever anyone has a change in their periods that seem to become less frequent, and especially if they're having some kind of menopausal symptoms as well. It's really devastating when women are told when they're doing fertility treatment, because it affects their ability to have children. But there is a very low chance, about 5%, of a natural conception, but most women will need fertility treatment to get pregnant. The other problem with having premature ovarian insufficiency is you're losing your hormones earlier, and so you're at higher risk of getting bone thinning, so osteoporosis. You have an increased risk of heart disease, an increased risk of memory problems. So it's really important that if you do have that diagnosis, that you consider taking HRT, which is hormone replacement therapy, and all we're doing is just replacing the hormones that would normally be there. So if you think you're one of these women and you're struggling with the symptoms and you're not sure about the diagnosis, then please go and see your doctor so that they can do these tests and then get you on the treatment if you do have that diagnosis.